My name is Jason Doctor, and I'm Director of Health Informatics at the USC Schaefer Center for Health Policy and Economics. I recently conducted a study on how to curtail overuse of antibiotics in primary care. And so our group has been studying research from the behavioral sciences that uses nudges, insights from research in psychology and economics to change people's behavior. And basically what this research boils down to is recognizing that physicians are people too, and that they respond to all the social cues and motivators that everyone else does. Every year, about 44 million prescriptions for antibiotics are issued to patients. Some of them have viral infections, others have bacterial infections. Antibiotics only work for bacterial infections, and it turns out that about half of those prescriptions are inappropriate. Physicians have been warned for years not to prescribe antibiotics for viral infections because this can cause antibiotic resistance, which then could lead to something we all want to avoid, which is a post-antibiotic future where antibiotics can't treat illnesses. Interventions like education and reminding physicians and also paying physicians not to prescribe inappropriately have had a small effect on changing their behavior, but not enough to make the difference that we need to make to address the problem. One of our interventions involved comparing physicians to their peers and giving them feedback on how they were doing with their prescribing. This intervention was designed to appeal to their desire to perform well in the workplace, to have pride in their performance. Second intervention that was socially motivated was called accountable justification. And accountable justification is an intervention where if a prescriber decides to prescribe antibiotics when they're not supposed to, we require that they justify a reason, and that becomes a note in the chart. The idea is that when the note is visible to their peers, then they will, this will engender reputational concerns if they don't have a good justification. The alternative is they can click out of the prescription and prescribe an alternative medication that's not an antibiotic. We found that these two interventions reduced inappropriate antibiotic prescribing 12 percentage points beyond education alone. Nudges are a new way of guiding policy using behavioral science. They're not punitive, they don't restrict choice, and they use psychology and economics to help change behavior. The general policy implications of this study are that we have new techniques that can be used in addition to education, pay for performance, reminders and alerts, and other techniques that we already use to address inappropriate antibiotic prescribing. Nudges work. Physicians are people too, and they respond to social cues just like everybody else.